And the case is that the Federal Ministry of Health has confirmed a coronavirus disease case in Lagos, Nigeria, known as COVID-19. The case was confirmed on the 27th of February 2020 and is the first to be reported in Nigeria since the beginning of the outbreak in China in January 2020. It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. He actually landed here in the evening of the 24th, but by the time he got into his residence, Lagos, already 25th. He was confirmed by the Virology Laboratory of the Lagos University Teaching Hospital, which is a part of the laboratory network of the Nigeria Center for Disease Control. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly. The multi-sectoral coronavirus preparedness group, led by the Nigeria Center for Disease Control, has immediately activated its National Emergency Operations Center and will work closely with Lagos State Health authorities, or let us say is already working closely with Lagos State Health authorities to respond to this case and implement firm control measures. I wish to assure all Nigerians that we have been beefing up our preparedness and capabilities since the first confirmation of cases in China, and we will use all measures and resources made available by the government to respond to this case. We have started working to identify all the contacts of the patient since he entered Nigeria, and even those who were with him on the aircraft. We have been in touch with the aircraft authority, the aircraft owners, to find out who his seatmates were. Please be reminded that most people who become infected may experience only mild illness and recover easily, but it can be more severe in other people, particularly those who are elderly and those who have other underlying chronic diseases. All Nigerians should therefore take care of their own health and maintain hand and respiratory hygiene to protect themselves, protect their families and others, following the precautions which I give you below. First, regularly and thoroughly wash your hands with soap and water and use alcohol-based hand sanitizer. Secondly, maintain at least 1.5 meters, about 5 feet distance between yourself and anyone who is coughing or sneezing. Persons with persistent cough or sneezing should stay at home and keep away from crowd, should not mix around in crowd, and should keep what we call a social distance. Make sure you and people around you follow good respiratory hygiene, meaning that you cover your mouth and nose with a handkerchief or tissue, or if you have none of these, sneeze or cough into the sleeve at the bent elbow, or use a tissue when you cough and sneeze, and dispose of these immediately. Stay home if you feel unwell with symptoms like fever, cough, and difficulty in breathing, and catarrh, and call NCDC, which is available day and night. That is Nigeria Center for Disease Control. And the number is 0809 and 70000010. It has been given before. Please do not engage in prolonged self-medication. Stay informed on the latest development about COVID-19 through official channels on TV and radio, including Lagos State Ministry of Health, NCDC, and Federal Ministry of Health. Citizens must not abuse social media and indulge in spreading misinformation and false rumors that cause fear and panic. The Federal Ministry of Health, through the Nigeria Center for Disease Control, will continue to provide updates and will initiate all measures required to prevent the spread of any outbreak in Nigeria.